Professor Daeyong Sun, head of gastroenterology department, the Second People's Hospital of Shenzhen. Cancer is a major killer of human health. The number of deaths caused by cancer is increasing every year. In 2020, there are 1.08 million gastric cancer patients, and the death rate ranks fourth in the world. The latest data from the World Health Organization, WHO, show that Helicobacter pylori infection accounts for 36.3% of all cancers caused by infections. As early as 1994, Helicobacter pylori was classified as a Class 1 carcinogen by the WHO. The latest WHO guidelines point out that Helicobacter pylori is closely related to the occurrence of gastric cancer. After infected with Helicobacter pylori, most people will cause gastritis. With the development of gastric inflammation, 15 to 20% of people will develop peptic ulcers. More seriously, 1.5% to 2% of people will cause gastric cancer. When gastric cancer is diagnosed, it generally progresses to the middle and advanced stages, and the prognosis of the patient is poor at this time. Once infected with Helicobacter pylori, it is like having a time bomb in the body, and we don't know when it will explode, which poses a great threat to the health of ourselves and our family. Therefore, regular screening for Helicobacter pylori, if infection is found, relevant measures can be taken for treatment in time, which can reduce the incidence of gastric cancer and other gastric diseases.
Professor Long Zhu. Helicobacter pylori is a gram-negative spiral-shaped bacterium with a length of 2.5 to 4.0 micrometers, a diameter of 0.5 to 1.0 micrometers, and 4 to 7 flagella at the end, which is highly mobile. After colonizing the stomach, Helicobacter pylori can secrete many pathogenic factors, such as cytotoxin-associated protein, or CAG-A, vacuolar toxin A, VAC-A, heat shock protein, HSP, and lipopolysaccharide, LPS, the most important of which are CAG-A and VAC-A. Helicobacter pylori can cause a variety of gastrointestinal diseases, such as chronic gastritis, gastric ulcer, Helicobacter pylori-related dyspepsia, gastric mucosa-associated lymphoid tissue lymphoma, gastric cancer, etc., and it is highly infectious. Its main transmission routes are oral to oral, gastro to oral, fecal to oral, and iatrogenic transmission. There are many clinical methods to detect Helicobacter pylori infection, including invasive diagnosis and non-invasive diagnosis. Invasive diagnosis require endoscopy with biopsies. Non-invasive diagnosis include urea breath test, stool antigen test, and serological test. The Kyoto Consensus points out that the urea breath test is currently the most recommended method for Helicobacter pylori detection in clinical practice. With high accuracy and specificity, this test is harmless for the human body through simple and convenient operation, and it is suitable for the screening and therapy effect evaluation of Helicobacter pylori. Shenzhen Headway Bio-Sci and Tech Company Limited is currently the world's largest manufacturer of carbon-13, carbon-14 urea breath test system with the most advanced equipment and the most accurate test results.
Professor Xiaojing Wu, Head of Cardiovascular Department, Shenzhen University General Hospital. Cardiovascular disease is one of the main causes of death in the global population, which poses a serious threat to human health. Coronary heart disease is the most common cardiovascular disease, and atherosclerosis is its main pathogenesis. In addition to traditional risk factors such as smoking and drinking, Helicobacter pylori infection is also closely related to the occurrence of coronary heart disease. The direct and indirect mechanisms of Helicobacter pylori infection that cause coronary heart disease include inflammation induced by chronic Helicobacter pylori infection, endothelial damage, increased coagulation and platelet aggregation caused by chronic activation of the coagulation cascade pathway, lipid metabolism disorders, and homocystinemia. In addition, the pathogen may directly affect the blood vessel wall by inducing the formation of macrophage-derived foam cells, initiating the autoimmune process and changing the traditional risk factors of coronary heart disease. Among the above pathogenic mechanisms, the inflammatory response is the main one, and other mechanisms interact with it to jointly promote the occurrence of coronary heart disease. For patients with coronary heart disease combined with Helicobacter pylori infection, treatment of Helicobacter pylori can slow down the progression of coronary heart disease. For patients with Helicobacter pylori infection, whose main pathogenesis is the virulence of bacteria, eradication of Helicobacter pylori is expected to reduce the risk of cardiovascular events in infected patients.
Professor Xiaoyin Zheng, Head of Gastroenterology Department, the Third People's Hospital of Shenzhen. It is human nature to love beauty. But did you know that Helicobacter pylori infection can not only cause stomach diseases, but also may cause you to get rosacea? Rosacea is a chronic inflammatory disease that occurs in the center of the face. The skin is manifested as erythema, papules, and telangiectasia. The age of onset is 30 to 50 years old. Generally, women are more likely to suffer from rosacea than men after the human body is infected with Helicobacter pylori on the one hand. The bacteria may release some vasoactive toxins to promote telangiectasia and skin redness. On the other hand, it will stimulate the body's immune system to produce a large number of inflammatory mediators, such as interleukin-1, leukotrienes, and platelet-activating factor, which will lead to the occurrence and further aggravation of rosacea inflammation. After eradication of Helicobacter pylori, the symptoms of rosacea can be significantly ameliorated. Moreover, related gastrointestinal symptoms, gastritis and hypergastronemia, can also be significantly alleviated. Therefore, if you find that you have symptoms of rosacea, you must check for Helicobacter pylori infection in time.